Hey guys, Dr. Segal, UroCoach. So in this video, I'm going to talk to you about the updated American Urological Association guidelines for prostate cancer screening. Stay tuned. As Dr. Segal, UroCoach. So obviously prostate cancer screening is a very controversial topic and hot in the news right now. We want to talk about the guidelines as issued by the American Urological Association to give you some framework for why urologists will do prostate cancer screening at certain ages. Please first like, subscribe, comment. We want to hear what you guys want to hear us talk about, okay? So let's take it age group by age group. And this is from the American Urological Association, also known as the AUA guidelines issued in 2023. And this is an updated version, okay? So first of all, let's take the individuals less than the age 40. What they recommend is no prostate cancer screening for this age group. Now, what does prostate cancer screening mean? It means rectal exams oftentimes, and certainly the PSA blood test, okay? So that's below the age of 40. When you get to the age 40 to 45, okay, they recommend a shared decision-making process between the patient and the clinician to talk about prostate cancer screening in the following individual categories. 1, African American race, because they are more predisposed to getting prostate cancer in their lifetime. 2, individuals with what's called a germline mutation. What are these? Have you heard of the BRCA1, BRCA2 genes? Okay, these are oftentimes discussed in breast cancer, but can predispose you to getting prostate cancer. So in these individuals, then you should consider prostate cancer screening between ages 40 and 45. And finally, individuals with a family history of prostate cancer. Okay, so just to reiterate, those are individuals at the age of 40, you should really consider doing prostate cancer screening. Let's take the next age group, 45 to 50, okay? So this is when the American Urological Association says you should begin discussing shared decision-making process about doing prostate cancer screening involving the PSA blood test and rectal exams in anybody, okay? Now, that's a conversation you have to have with your urologist or your clinician, but that's the age where they recommend starting that conversation as a blanket statement, all right? The next age group, 50 to 69. This is the group where they say prostate cancer screening should be done with PSA blood tests and consider rectal exams every 2 to 4 years. So that's probably the most common population, aged 50 to 69, where prostate cancer screening is done commonly. Now, interestingly, and this is what people oftentimes want to know about, is what do they say for ages above that? They don't give any recommendations for ages above 69. What they do give you guidance in regard to is measuring the benefit of prostate cancer screening in individuals older than age 69 versus the risk, right? When you do prostate cancer screening, it does carry risks, right? Potential unnecessary biopsies, unnecessary tests, costs for the healthcare system, all of these things. So what they would describe is that individuals above the age of 69 with a life expectancy of greater than 10 years, now that's different for every individual above the age of 69, then there should be a shared decision-making process as to whether they would benefit from prostate cancer screening or not. So they don't give a blanket statement above that age. The other thing to mention about all this is that each urologist and each clinician will tweak their screening protocol differently, right? So although it says that 2 to 4 years is the interval where PSA should be checked, individuals between ages 50 and 69, that's not always what urologists do. Oftentimes they'll do a yearly rectal exam and PSA, so it's at their discretion. They may do it more frequently than that. Anyway, guys, I hope that gives you a quick primer on the AUA guidelines for prostate cancer screening as issued in 2023, and many urologists practice by these guidelines as well as other clinicians. Please like, subscribe, comment. We want to hear what you guys want to hear us talk about. Thanks so much for listening.